So I'm actually still at the Ohio State University, but I'm moving to Hawaii, the University of Hawaii, in about 2 months here. So we have covered a lot of basics, and I'm going to kind of try to get us back on track here. Here are my disclosures. We're going to talk about the instruments itself and the principles itself without naming too many instruments here. So these are the type of energies that we use in surgery. The main thing I'm going to focus on are the bipolar instruments that we use. The nice thing about bipolar instruments are, remember back in the day when you used to cut, tie, or cut, tie, and so we changed that now, right? We're doing everything at the same time. We're going to tie these vessels off, and we're going to cut it at the same time. So it really has increased the speed of our operations. So I think it's very important for us to know how we use these. So we went through this diagram many times. The active electrodes are on the end of the instrument, so there is an advantage there. We keep the energy right between the area that we want to work on. These are some of the advanced bipolar devices that are out on the market right now. So I think our mouse, okay. So one of the things I want to talk about really on bipolar energy is the injuries that you can have. So in this study here out of Japan that was published in 2015, they looked at 7 different types of energy devices, and they looked at laparoscopic surgery performed on pigs. So the one thing they wanted to really look at is the tissue temperature at a distance of 1 millimeter away from the energy device before and after dissection. The temperatures of the device blades were kind of measured both before and after dissection, and the time it required for the energy device to fall below 100 degrees Celsius, 75, and 50. The temperature of the surrounding tissue using each device rose the most with monopolar devices, especially on the coag mode. It rose on average of 50 degrees Celsius, and the least with the ultrasonic type device, 6 degrees Celsius. The device temperature itself, so we're talking about when you use that energy device and you're trying to retract tissue, it rose the most with the ultrasonic type devices and the least with the bipolar devices. But still, look at how hot that ultrasonic device can get, 318 degrees Celsius. So we know that tissue death occurs at 60 degrees Celsius. Just imagine you're dissecting the short gastrics down, and your resident goes, you know what, I'm going to push the colon got in the way, so instead of using my retracting non-energy instrument, I'm going to use my ultrasonic instrument because it's right there. I'm going to push the colon away, right? When it got to 318 degrees Celsius, and then 5 seconds later, you're going to try to push that colon away. So I think the key principle here, it's like flying on an airplane. You have somebody outside your airplane with a ball-peen hammer pounding on that airplane. When you look at the airplane, it probably doesn't do damage. It's the same thing when you touch tissue when it's greater than 60 degrees Celsius. You don't know if that tissue death occurred, but we know that tissue death occurs at 60 degrees Celsius, and the more times you touch the bowel, the more times you touch the colon, in a couple of days, that colon can fall apart. So I think it's very important to understand the temperatures that these instruments can get to. And we all know that thermal spread happens with each instrument. And it's very important to understand because you can't see it. So actually in our lab here, we have a ultrasound, or we have a advanced bipolar instrument, and we're using it on a piece of ham. And on this diagram, there's 2 wires that are 5 centimeters apart. We have a FLIR thermal camera. Anything you see in yellow is tissue death. So when we're using our advanced bipolar energy instrument, as we cut up there, we have a rim of tissue death around that we can't see. So here's a quick video of myself here. So I'm utilizing the principle here. We're cutting down. We have a FLIR thermal camera right next to it. And you can see that when you cut on the tissue, you really can't see that thermal spread. But on the camera, you definitely can see that. So one of the principles here is, even though you can't see the damage is occurring. Tissue death occurs at 60 degrees Celsius, and we have to always be cognizant of our surrounding tissue when we operate. So other things that can happen with our devices, current leakage. So the active electrode cords can leak current through them. We saw that with Amin's last video where the ham hanging off the instrument actually can conduct energy and cause injury. So the active electrode should not be wrapped around your metal clamps. You should never use a metal clamp or a hemostat or a Kelly to wrap the cords around. You should always use non-conducting type clamps, your plastic clamp that everybody hates, but that's the one you should use to wrap these cords. And definitely keep your cords away from any pacemaker. The worst thing you can do, right, if you're the attending surgeon, you're standing on the left side of the table, most pacemakers are on the left side of the body. So what you do, you wrap your monopolar cords, you wrap your bipolar cords, your light cords, and you put it in the left upper quadrant, usually right over the pacemaker. So if one thing you can do when you set up your OR, make sure you know the patient has an AICD or a pacemaker, and when you're wrapping those cords, keep those cords away from those types of devices. So the pros of, I think, advanced bipolar and why we love it so much is it doesn't require a dispersive electrode. You don't have to put the dispersive electrode on the patient. Energy really doesn't travel through the entire patient. We try to have that energy travel through that concentrated area of, that we're working on. It definitely uses less voltage. It uses the cut waveform. So if you're involved in an emergent operation, probably the worst device to use is a monopolar instrument. The best device to use is the ultrasonic energy device because it has really no electrical energy dispersed through the patient. And I think advanced bipolars kind of fall right in the middle. And then we can seal vessels up to 7 millimeters in size. Definitely the cons for the advanced bipolar devices, you have thermal spread 1 to 3 millimeters, current leakage through the cord, and a significant increase in the cost compared to other monopolar instruments. Smart generator technology, we have near real-time impedance. It pulses on and off very quickly and has audible signals to tell us when we coag tissue. So also, the burst pressures are very high. If you look on this chart, most of the instruments seal vessels up to 300 millimeters of mercury. So just make sure if you're sealing large vessels, you keep your blood pressure of your patients under control. Seal times vary with different devices. You also need to know that. And I think the best practices for or bipolar instruments, no tension on the tissue. You don't want to really lift up on the tissue. You want to let the instrument do its job. Keep the jaws clean. You can seal vessels up to 7 millimeters in size, but be careful of calcification in the vessels because it can affect your seal. And these are all the devices kind of compared together. I really like advanced bipolar instruments. There's no direct coupling. There's no capacitive coupling. Alternate site injuries are very low. You can have inadvertent activation, but it's very easy to control because you have to push a button to actually activate the instrument. And in conclusion, I think it's very important to understand the fundamental use of surgical energy in the operating room. It is everybody's responsibility, not just the surgeon. You need to choose the right energy tool for the task at hand. And once again, tissue death occurs at 60 degrees Celsius when you're working with a resident or fellow and they're moving tissue away with their energy instrument. Remember, that is like hitting the airplane with a ball peen hammer every single time. You don't know when that one touch is going to be the cause of a major complication in the future. Thank you very much for your time.